My name is Rachel Stiff, and I'm a licensed marriage and family therapist.
Mm-hmm.
And recently, as of just this year, I'm a certified life and health coach.
That's kind of a trend with a lot of, what do you think that adds to the value? What is the difference there?
You know, for me, it was a little bit re-energizing because I've done therapy for so long. It was definitely re-energizing and a new way of doing things. I'm very holistic in my approach and trained systemically, and so the coaching program that I went through is also very holistic and systemic in nature, which is hard to find with a coaching program.
Yeah.
So it just fit right in with what I do, and I think it's just giving a new tool to help other people heal and have transformation in their lives. So I kind of wanted to branch out in the way that I could serve people.
Yeah.
Because there's some people that, you know, there's still a little bit of stigma of mental health, I think, and so some people.
But everybody, even executives, go see a coach. Explain to the audience what a trans-systemic system and approach is.
Systemic and holistic. You're approaching mind, body, spirit, and emotions, like the whole person. If someone is dealing with chronic health issues or chronic pain, a lot of times you're going to see simultaneously dealing with depression and anxiety. We have 4 tanks: mind, body, spirit, and emotions, and they're all interlinked, but they're all part of the same whole. We in of ourselves are a system. Systemic can also be, say if I'm meeting with someone for individual therapy, I'm thinking in the back of my mind, possibly there's someone's sister or daughter or friend or parent. So, and then trying to look at the whole context of their life, not just the presenting issue or the presenting symptoms, but looking at systemically what is going on. You know, what are their stressors with work, even if they're not saying it, or home, or the past coming up. So just really trying to look at the whole picture and the whole person.
Tell us a little bit about your personal journey to, you know, maybe deciding to be a licensed therapist, or, you know, we all go through a personal journey. How did you get here? What is your why?
I love that question. What is your why? My personal faith in God. I just really see what I do as a calling, but I definitely don't impose that or bring that into the therapy room or coaching with people unless they specifically ask for that. So there's such a sense of purpose, and that sense of purpose and meaning started in my 20s, which was about 20 plus years ago. And I think just growing up, my personality, my mom said even as a 3-year-old, if someone was walking by and they were crying or just looked distraught, that even as young as 3, I would want to say, "Are you okay?" Or, you know, "Look, they're hurting."
So you're a caretaker at heart.
Yeah, that compassion. And then throughout the years, friends would come to me for advice, even some family, and it was just kind of part of my DNA. But I didn't recognize that until my 20s when I pursued graduate school, because I actually wanted to keep traveling overseas. I did some of that. And I wanted to be a veterinarian.
I think every caretaker at some point thought they wanted to be a veterinarian, for sure. Yeah, it's like an empath. I think we've determined that empaths also want to help animals. Yeah,
that's interesting.
Yeah.
Now that I think about that, that's true.
Yeah.
Yeah, and I grew up performing on stage, singing and acting, and just loving people. On Myers-Briggs, my 4 letters are the ENFP. I'm really big about the Myers-Briggs.
Yeah.
2-wing 3, the helper. And so I think just as life went on, what ended up happening is I started working for a child welfare agency in my early 20s out of undergrad. And one of my supervisors, she's an LMFT, and this is in Kansas, and she one day just said, you know, this is something that you are gifted to do. To go further with people, to do therapy. And so one day she put the application for the master's program on my desk and said, "You're going to be in trouble if you..." Okay.
How did you feel as you were training and as you were seeing patients by yourself, when you got those stories, or you get those stories of pretty severe, maybe grief or trauma or, kind of that messy or complicated patient.
When I'm working with a client that has, every person has their own story, and so, and every trauma, each person walks out, their own story and their own trauma very differently. And so the way that I was trained is holistic, systemic, but also very relationship-based. 33% of therapeutic change starts with the strength of the therapeutic relationship. So the first part that I focus on is, who is this person? Even if I've heard this kind of trauma before, I haven't heard their story. I haven't gotten to know them. And so really looking at building, that therapeutic rapport and that relationship and hearing their story first. Establish a framework of what's their coping, what's their support system, grounding skills, and even practicing those in the session with them. Pay attention to what's going on in your body. There's this great book, The Body Keeps the Score.
You can freely talk about that, absolutely. It's a classic for sure.
Yeah, it's a great book. How we feel our emotions and store our traumatic memories and stuff in the body in different places. A lot of times when we start working on our mental and emotional health, that a lot of times you'll see physical symptoms even dissipate. With that as well. I've seen that a lot. Going back to the framework, it's the rapport would be number one. And letting them know, I don't want to lead you in telling your story. I want you to feel free to share as you're ready. As I'm hoping to prepare them to be ready and establishing that rapport, looking at, again, the grounding, coping, their support system, paying attention to what's going on in their body, their thoughts. As we start to go through, sometimes in session I'll have them pause and I'll just say, hey, let's breathe. Let's do those belly breaths. I can tell you're getting in the sympathetic, the stress state. Let's go into the parasympathetic and start to breathe through that, ground. And there's so many different things and theories I can do. It's very integrative with the individual person.
How long?
I've been in the mental health field for, 22 years, since 2001.
Okay.
And then practicing as a psychotherapist since 2006, so 17 years.
Okay.
Yeah.
And you recently felt a call to maybe be doing something else or taking that to a new level?
Yes.
What are some things that
absolutely.
come to your mind when you think about being able to help outside of that one-to-one relationship? Not that you have to go, and do them. I'm just wondering where you're being led.
Oh, thank you. I appreciate that, because there's an accountability.
Once you say it on video.
Right, I'm all about teaching people, let's get out of our comfort zone. With what we do, it's a sacred privilege, and there's such an accountability to it. It's kind of that practice what you preach type of thing that I really want to be congruent with my clients as I am in my personal life. So as I say these things and I tell people, let's step out of your comfort zone. That's where change happens. I've had passions and desires for a long time to really write.
What would you write about?
Oh, I have 12 topics. So many. I love to talk and write.
Give me two.
Therapy and incorporating your faith. And whatever your faith is, having that anchor. Natural health and wellness and how that impacts our emotional and mental health.
Okay.
Handling stress, because everyone is stressed right now in some way, and how that impacts us. Oh, there's so many. And so I really
feel you could start a YouTube channel, a blog. Have you thought about those things?
I've been putting a blog off for about a decade. I started working on my first one. I've been so encouraged by my friends and colleagues just to say, you got to get stuff out there because you do things differently. And so, and I do, I have a passion to share what I know and what I do, and it all comes from a place of loving people and wanting to help bring hope and healing and transformation to a hurting world. That's actually the motto of my LLC, which is Restoring Relationships.
Oh, nice.
Is to help bring hope, healing, and transformation to a hurting world. So I just developed that website just in the last week, and I started writing my first blog. and then met with a publisher earlier this year so I can know exactly what direction to go in to hopefully publish someday. And then I would love to do more speaking engagements and just teaching, and half therapy and coaching, and the other half like consulting, teaching, speaking.
Good. You verbalized it now. That's great. We were talking a little bit about that faith community and how in the professional world, especially for us here, we take insurance. And so it's like there's this, you're not allowed to talk about religion or faith. And I think it's something we need to like kind of challenge in the culture. In the Mentally Strong Method, we have a section called spiritual conflict. And several of my counselors kind of have a hard time with that because they don't want to proselytize their personal beliefs if they have one, or, we have counselors who don't have a specific belief system. But I talk about this all the time. Like, we are spiritual beings, and when there is grief, when there's trauma, there's often a spiritual conflict. For me personally, I was a believer. I am a believer, but really wrestle with God over the loss of my children. Right? Like, I think it's something we don't talk about enough, and especially in the church. Right? I feel like in the church, I get a lot of verses that are supposed to be comforting, but they're actual triggers for that conflict, that spiritual conflict that I have. And so I think it's healthy for us to kind of bring in the spiritual discussions, right? And continue on that path. So I would love to see the Mentally Strong Method like taught in churches and things like that. So I'll have to share a book with you to see if you're interested in teaching that in the churches and stuff. But
I would love that. And I've watched some of your videos and heard some of your story as well. And I so appreciate your authenticity and the way you share, and even word.
That's what I'm trying to portray. So it is definitely a compliment when someone uses the word authentic, because that is what I'm trying to portray and trying to be real. And it's ugly sometimes. Grief is ugly, and the things that we say to ourselves is sometimes ugly. And
absolutely. And I like how you term that spiritual conflict, and even with some of the scripture, because I've had a lot of clients that when they've lost a loved one and or whatever kind of grief and loss also related to their trauma, and a lot of people have left their faith or their faith has strengthened. I mean, it just depends on their own journey and walk.
Right.
And one of the things that I love, and I know you know about this too, is that dialectical mindset of both and.
Both can be true, yes.
Yes.
Yeah. Explain that to the audience. Yeah.
Oh, man, both and is so awesome. So it's where two seemingly opposing things can be true at the same time, or they are true at the same time. Life can be both messy and have a lot of suffering and sorrow, and also be joyful and be a blessing, you know, on a growth journey. Recently, I was working with a family, and the child, maybe early teens, had lost her father a couple years ago. And so we were working on the both and it was a sudden loss. She can hold hope and grief at the same time. And she loves to draw. Two big hands, and the pinkies were touching, so I think that's why when I talk about the both and, I have them touch now. And in one hand was a light, and then in the top of the light was a cross, because she's a Christian, and that's her faith background and her beliefs. And then the other part was a tear. This is grief, and this is hope. I've learned that I can hold hope and grief at the same time.
Yeah.
And so
that's beautiful.
Yeah, the hope and mentality. No matter what your faith background, whatever person's journey is, I want to love people where they're at. We're all on our own journey. The both and mindset really promotes growth and healing, because you can hold both at the same time. It's not all good or all bad. It's like I can be sad and also be at peace at the same time, hold hope and grief at the same time. Versus an either or mentality really promotes more of a fixed mindset, and doesn't promote growth.
You should be always working on your mental health. And then that same mentality of, I'm going to go and the therapist or the doctor is going to fix the problem. And it's not just a physical problem. I mean, we do medication here, and sometimes that is helpful, and there is a physical component. But mental health is more than a physical component. It is, you know, we talked about the physical, the mental, emotional, and spiritual, all, you know, and then the environment that you're currently in, you know, your past experiences, all that plays a role in your mental health. Yeah.
Oh, that's so good. That's that holistic, systemic approach. I love that.
Well, and just kind of getting away from that, we can fix you, right? Like you have to be on this journey with us. We can help you. We could be your advisor. We could be your coach. But we can't fix, you know, what's happened to you or how you, you know, control your mind and things like that. And so it's kind of one of my pet peeves of moving forward in mental health and trying to revolutionize the culture of mental health of like, it's not about fixing, it's not about mental illness. Yes, I'm grateful that we have all this anti-stigma around, you know, campaigns and things around mental illness, but it's more than that. We're all on a journey, and let's acknowledge that, and, you know, everyone get better together.
Oh, that's so good. It's very collaborative because you're right, there are people that have that mentality. Well, I'll just go and be fixed, you know, and it is a growth journey, and it's up to our individual choice to step into and lean into the pain. You know, one of my things is you gotta
lean in the pain.
Yeah, you have to feel in order to deal, in order to heal. Is what I tell people. And
do you want to share any of your own personal stories or of, you know, having to do that, you know, practice what you preach?
Yeah, you know, there's so many. Just I feel like I'm growing every day. But I myself have some history of trauma that I had to heal through, trauma and pain, and a lot of things that didn't surface for me until I was in graduate school. And it's kind of funny because that was a piece of humble pie, because I didn't really realize a lot of things that I had. Because, you know, when you go through things, whether it be pain and trauma and different things in your story, it can become familiar, and you may not even realize that you have that. And so in graduate school, it was really humbling to be, it was a very intense program, the MFT for one. And for another, one of our clinical supervisors, he's just awesome person and just became a mentor of mine. He would try to, in essence, in a good way, try to get us to break, if that makes sense, in a good way to be able to.
I do that to my counselors too.
Oh, that's wonderful. That's wonderful.
Yeah.
Helps them become better counselors. If you can't first know what your own emotions are and work towards your own healing, work through your own stuff, that's going to come out. You know, you bring who you are into sessions. You have to stay healthy. There's that accountability. I was just really focused on this. And then finally some things came out, and I just was a big puddle and a mess and just completely broken, just realizing those things and voicing them. You have your own narrative, right? And so my narrative was everything is great and fine and happy and I'm blessed. And while that's part of the story, that wasn't the full reality. And a lot of times it's not till we get fully authentic and real with what we've been through and how that's impacted us until we even know that we need healing. And that's when my own healing journey started. And as I just broke down, the whole class clapped and celebrated. They're like, okay, now you're ready to start training to be a therapist. That was
And
awesome.
how did you work through some of your own trauma? Like what kind of techniques? What did you do? Because a lot of people watching are people who are kind of trying to do this on their own. And so some things that you did to release some of that trauma.
What helped me at first was having a therapist that I really could trust and really felt that she truly cared for me and came from a place of love and compassion. So she really got to know me and my story, and she was patient with me and took the time. And some of the modalities and things, she was very integrative, which I'm very similar in that way too, but very emotion focused, narrative, a lot of CBT, and I do a lot of CBT myself, cognitive behavioral therapy, the trauma focused as well.
And I always talk about that as the basis, the foundation for good, healthy mental health is that cognitive behavioral, and then building on some of those other techniques.
No, actually, that's the foundation of the mentally strong program.
Yes, so we talk about mental strength being an attribute that we respect in people, but we don't teach it anywhere until you get to a point where you need to go to a therapist, right? We should be teaching our children, our young adults, like the way you think, impacts your behavior and your mood. And so if you can learn how to think properly before trauma, because everyone's going to experience something that's difficult, right? If we can kind of have that basis of how do I control my mind, and even before you knew you had trauma you needed to deal with, you had already reframed your story. And it's okay to reframe your story, but true strength comes from insight of why I'm reframing my story and letting go of that trauma, not just putting it in a box somewhere, so.
Oh, I love that. That's so good. Yeah, the letting go, the releasing. Because if it just gets put in a box somewhere, it's going to manifest in a different way later on in some way.
The culture, how connected the mental health and physical health is. Like, if you do not process and grow in your mental health, it will manifest in a physical. It could be a real diagnosis, right?
Yeah.
It could be fibromyalgia, it could be inflammatory, it could be even a heart attack, it could be high blood pressure, but it will manifest physically.
Yes. Yeah. Oh, that's just so powerful. Everything is interlinked, and when you're talking about thoughts too, and how we think, how powerful that is.
Yeah.
Our mindset is the control tower of our lives. The way we think, and when we even realize that we can choose how to think, because a lot of times with our beliefs and our thoughts have become beliefs over time, and those false beliefs that get so rooted, that becomes our mindset, and we don't know any different until we're told different.
And sometimes we have to be careful with mental health diagnoses because people own them, and then they say, well, I can't control this. I have anxiety. There's nothing I can do about that. Well, you may be predisposed and you may benefit from medication for that. However, you still can learn to control that. Like, there are ways to change that mindset, and believing that you can control it is part of that mindset.
Absolutely. And that when people start to believe that, that shifts them from that disempowering mindset that they are, or even that their diagnosis can be their identity, or that they can't, or there's no other way, that fixed mindset, to an empowering, and that's
my word. I love to.
There's such power in that. It directly affects our emotions, and then that directly affects our actions and our decisions. What you're doing is great.
I am looking forward to see where God leads you and where you will be using your skills to help a wider audience. I'd love for you to look over the Mentally Strong Method, see if it's something you'd be interested in teaching and taking that into the churches and stuff. I'd love to see that.
Oh, I would love to do something like that, and I'd be honored to.
So anything else you want to share with the audience?
I get passionate about so much in what we do.
Well, share your practice, maybe the website, how people can find you.
I may have to look up the website.
We will put it in the description.
It's new. I established my own website finally in the last week. It gives a fuller picture of what I do and what I'm about. Restoring Relationships, LLC, was created in 2019. And it's, again, about bringing hope and healing and transformation to a hurting world. And I just want people to be encouraged that no matter where they are, even if they feel like they're in their darkest day and they don't see any hope at all, that there is hope, even if it's just a little bit that they can grab onto that day to carry them to the next day. And that they're not alone, that we all have our own journey and our own story. and that healing and freedom, you know, and purpose and identity, and going through that journey is possible, and breakthrough in those things is possible, and healthy change is possible on this side. When people can start to grasp a little bit of that, even a little bit, it can give them that hope to carry them the next day. And if people are in wherever they're at in their journey, if people are doing pretty well and they're like, you know, I feel like I'm functioning well and not really having anything specific to process through, then just knowing too, well, is there any fear? We all have our fears. The minute that we release one fear, another one can pop up. And so I still haven't released my fear of spiders. I have a huge arachnophobia. And the exposure therapy to that did not help.
That would be torture, probably.
Even if a person feels like, well, I don't know if I really need therapy, or maybe I've processed through and worked through some stuff. Well, just having an open posture and mindset that to always be growing. I think that it's adventurous. I view life as an adventure. It's always changing.
That's my motto, always growing. Keep it growing, keep going. I wish everyone would be, really embrace that.
Because then it's, there's no such thing as perfection, and there's no such thing as a point of arrival. It's all a continuum and a journey. And I think when people can grasp that too, it can almost give you like a relief, like, oh, I don't have to have it together today. So even if people are in that place, there's always a fear, or something. Like, what's a dream that you have that maybe you haven't gone towards yet? What's an obstacle that you're facing? So, and that would be more of a coaching, probably. So,
have you thought about doing like group coaching and things like that?
I would love to do more workshops, group coaching. I would love to serve in a way where it reaches a bigger group of people. I love what I get to do in my office, but I would love to be able to reach more people, because there's a need for that.
Absolutely.
So I look forward to those new things.
Yeah, I look forward to hearing where you end up and how you use that call that you've received. I think it's time. 2 years ago is well, thank you very much.